5 Medicare enrollment mistakes to avoid. That's what we're going to talk about in today's video, so I hope you stay tuned. Number 5 is really important. In fact, I don't hear a lot of other people talking about this, so you're going to want to stay tuned to the end to hear all 5. If you're new to my channel, my name is Jamie from meetjamie.com. I'm a licensed insurance agent specializing in Medicare insurance. I help people all over the country understand how the Medicare program works, as well as help them find the coverage that fits their needs. Best of all, my services are completely free. If you have questions about Medicare, you can drop me a comment below or visit my website, which is just meetjamie.com. So, you're thinking about retiring, you're thinking about enrolling in Medicare, and you're wondering, what are the steps that I need to take? What are the pitfalls that you need to avoid? And so I'm going to share that with you today. And number 1 in my list is waiting too long to enroll in Medicare. And I'm going to share my screen with you here and talk a little bit about what I mean by that. Everyone's situation is unique, and so the very first step with signing up for Medicare is deciding or figuring out if you're going to be signed up for Medicare automatically. So this is just from the Medicare and You guide. You can download it as well. If you don't have a copy of it, I'd be happy to email it to you. So there's a couple questions to ask when it comes to signing up for Medicare. Number 1, will I get Part A and Part B automatically? So it says here, if you're already getting benefits from Social Security or the Railroad Retirement Board, you'll automatically get Part A and B starting the first day of the month you turn 65. If your birthday is on the first day of the month, Part A and Part B starts the first day of the prior month. If you're under 65 and have a disability, you'll automatically get Part A and Part B after getting 24 months of disability benefits. And then it talks a little bit here about ALS, and then it says down here, will I have to sign up for Part A and Part B? If you're close to 65 but not getting Social Security or railroad benefits, you'll need to sign up for Medicare. And then it tells you how to do that, which is just ssa.gov/Medicare. It's listed for you right there. So the big thing to remember is that you have what's called a 7-month window to do this if you do not have Social Security benefits or railroad benefits already. So the way that it works for most people is it's 3 months before the month of their 65th birthday, the month of their 65th birthday, and 3 months after your 65th birthday. And so that's kind of the number to keep in mind. Again, there's other situations that people have. Maybe they have a disability, maybe they had employer coverage and they worked past 65, but generally speaking, the vast majority of people are eligible for Medicare at 65, and that starts that countdown, so to speak, that 7-month. It's called an Initial Enrollment Period, IEP. So that's the first thing that you want to know when signing up for Medicare. Those are some of the basic questions you have to answer. The next big mistake to avoid is not comparing your coverage options. And what do I mean by that? So let's jump back to the Medicare and You book. So in the Medicare and You book, what you see here, and this is on page 10, is that you have 2 paths to Medicare, assuming you're going to sign up for Part A and Part B. So the 2 paths to Medicare are original Medicare A and B. You can add a Part D prescription drug plan, and you're going to want to do that if you don't have prescription coverage elsewhere. And then a supplement, also known as a Medigap plan. So that is option 1. As you can tell, pretty straightforward, right? The other option is a completely different way to receive your Medicare benefits. That's what's known as Medicare Advantage, also known as Part C. So what happens is you'll see these ads in the fall. They'll promote these ads that have benefits above and beyond Medicare, like vision, dental, hearing, some of those other things, flex cards, grocery cards, those types of things. Whenever you see ads like that, most likely it's in this category, the Medicare Advantage plan. So what is Medicare Advantage? Well, Medicare Advantage is a Medicare approved plan from a private health insurance company that offers an alternative to original Medicare for your health and drug coverage. These bundle plans include Part A, Part B, and usually Part D. So you say, well, what's the big difference between original Medicare and Medicare Advantage? So let's just look at what the Medicare and You guide says. So a couple of things I always highlight for people. With original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the U.S. So with Medicare Advantage, the difference is in many cases you can only use doctors who are in the plan's network. You see that there? That's one of the biggest differences, because most people, they like the idea of being able to keep their doctor. They like the idea of being able to have the freedom to go where they want. So the different types of supplement plans or advantage plans can vary greatly, as well as the company where you choose to hold that coverage. But again, that's just one of the things that you want to do is compare the two paths to Medicare that you have. Next, this is a big one as well, is let's say that you choose original Medicare and then you want to add the Medicare supplement or Medigap plan, let's say Plan G, Plan N. Well, what you need to know about that is separate to your initial enrollment period to Medicare, there's what's called the Medigap Open Enrollment Period, and you don't want to miss this. So again, this is page 77 of the Medicare and You handbook. It says, when's the best time to buy a Medigap policy? See that there? The best time to buy a Medigap policy is during your Medigap Open Enrollment Period. This 6-month period begins the first month you have Medicare Part B and you are 65 or older. And then it does give some exceptions to that. Some states have additional open enrollment period. But the main thing you want to remember is this. After this enrollment period, you may not be able to buy a Medigap policy, or it may cost you. So with Medigap, also known as Medicare Supplement, you have, each person that's a Medicare beneficiary has this 6-month open enrollment period to get a Medigap policy. Why is that important? Well, let's say that you decide I'm going to take my Medicare benefits at 65, and you know that you have some health issues. Maybe the last couple of years, you've been going to the doctor more, you've been having more tests done. Well, the reason this is important is this Medigap open enrollment period, the supplement company has to cover you even if you have some sort of health condition. And the reason this is so important is if that 6-month window closes and you don't take advantage of it, and let's say down the road you want to get a Medicare supplement, then you may have to qualify for that plan by going through medical underwriting, where the company can actually deny you based on your health conditions. And so you want to make sure that you don't miss that 6-month open enrollment period. Okay, let's talk about number 4. So let's go back to the very beginning, the very first point that I had, and let's talk about signing up for Medicare. So let's say that you decide to sign up for Medicare and you decide, hey, I'm going to choose this path, original Medicare and a Part D prescription drug plan. What you need to know is that with this Part D prescription drug plan, you have to do it within the window of your initial enrollment period, that 7-month window as well. Okay? And what you're going to want to do is make sure, because a lot of people call me and they'll say, hey, how do these Part D drug plans work? You can look at them yourself on Medicare.gov. The prices and the coverage vary greatly. What a lot of people don't realize is that the price that you pay for a Part D drug plan might be different than someone else. And why is that? Because it is based upon the drugs that you take. So if this is page 81 of the Medicare and You Guide, so it's talking a little bit here about Part D drug costs. So it says this: your drug costs will vary based on the plan you choose. Remember, plan coverage and costs can change each year. You may have to pay a premium, deductible, co-payments, and co-insurance throughout the year. Learn more about these costs on the next page. Look right here. Your actual drug coverage costs will vary depending on the very first bullet point here, your prescriptions, and whether they are on your plan's list of covered drugs, also known as the formulary. Also, what tier a drug is it in, which drug benefit you're in, which pharmacy you use, whether or not you get extra help paying your Medicare drug costs. So you want to be very careful that you don't just randomly choose a random prescription drug plan based on the monthly premium. I know a lot of people, they think in terms of the monthly premium. They go, I'll just get the cheapest one. Well, you have to remember there's multiple factors that go into this, including the prescriptions that you take, including the tier that those prescriptions fall under, including the pharmacy that you go to. So you want to be careful about that. So again, just to recap so far, so the 5 mistakes: waiting too long to enroll in Medicare A, B, and D, not considering your Medicare options. Remember, supplement with or original Medicare with a supplement or Medicare Advantage. Missing your Medigap 6-month, open enrollment period. The initial enrollment period is 7 months. The Medigap open enrollment period is 6 months. Not evaluating your prescription drug coverage based upon the drugs that you take, the pharmacies that you go to, and those sorts of things. So what's number 5? Well, number 5 would be relying solely for your Medicare information on friends, family, and the internet. So why do I say that? Because there are a lot of people who have a little bit of information about Medicare, and usually there's gaps in knowledge from whoever you're talking to. So whether it's a family member, a friend, sometimes even, unfortunately, insurance agents themselves. You want to make sure that you work with somebody who specializes in Medicare, because you can look to the internet, you can look to friends and family, you can listen to YouTube videos, but at the end of the day, you want to find somebody who works exclusively with Medicare beneficiaries and is going to look out for your interests, not an insurance company and not their business. What is right for you? So you say, well, how do I do that? How do I find? Well, what I do in my business is I set up an initial consultation call. Again, it's all free, just to understand your unique situation a little bit and whether or not I would be a good fit for you as your agent. And so there are some certain questions that I ask. There's some questions that I allow people to ask me, just to really better understand, hey, is this a good fit? Are we a good fit together? Because my goal is to establish a long-term business relationship with my clients, because there are changes every single year to the Medicare program. And it's nice to have someone that you know is keeping up to date with all those changes. So again, if you have questions about Medicare, feel free to reach out to me through my website, meetjamie.com. You can also leave a comment below. If you like videos like this, I'd be honored if you hit the like button, subscribe to my channel, and maybe share it with a friend. So thanks so much for watching, and we'll see you in the next one. Have a great day.